Hi, I'm Wimao Jie from Group 4. I'm doing script writing, resource collection and preparation, and slide preparation for this video assignment.
Hi, I'm Jiong from Group 4. Today, I'm going to present to you about the use of Radiotracer FDG in positron emission tomography scans. Now, let us dissect our topic by first focusing on the keywords. A radiotracer is a chemical compound in which one or more atoms have been replaced by a radionuclide. This means these compounds will emit radioactive rays through the decay of the unstable radionuclide. We can use that property to track the radiotracers as it is emitting energetic radiation, hence the name radiotracer. Radiotracers have very broad applications, but we are going to focus on how radiotracers provided us with a powerful 3D medical imaging technique known as positron emission tomography (PET) scans. In PET scan, we perform intravenous injection to introduce a radiotracer into the subject's bloodstream in order to study the biological and biochemical processes going on inside the subject. Hence, in this context, they are sometimes called radiopharmaceuticals or radioactive drugs. But how do we choose what radiotracer to use? There are a few important factors to consider before we decide on a radiotracer to be used in PET scans. In PET scans, the radiotracer has to have a short half-life so that the radioactive substance wouldn't stay inside the patient's body for too long and pose any threat to the health of the subject. Secondly, the radioactive ray it emits must have high penetrating power. Obviously, because the radiation from the radiotracers has to be able to penetrate the human tissue. Thirdly, depending on which biological parts and processes we wish to study, the radiotracer used can virtually be any biological molecule. For instance, a hormone, a protein, or a common sugar like FDG, so that it will be absorbed by the appropriate organs or tissues. The radiotracer most commonly used in PET scanning is a type of radioactive sugar called fluorodeoxyglucose. In an FDG PET, the subject's sugar metabolism is imaged as it corresponds to the distribution of FDG in the subject's body. Fluorodeoxyglucose (FDG) is structurally and chemically analogous to glucose, but with a single oxygen replaced with a radionuclide, which is a radioactive isotope of fluorine. So why would we care about sugar metabolism? One of the key realizations is that tumorous tissues have a higher glucose uptake than normal tissue. This means FDG will accumulate in tumor. This simple fact makes FDG an invaluable radiotracer for cancer diagnosis and cancer patient management. Now, let us take a look at the working principle of PET scans while summarizing what we have established in our discussion so far. Positron emission tomography is a functional imaging technique. It uses radiotracers to visualize and measure changes in metabolic processes. As mentioned, the radiotracer is introduced into the patient's body via intravenous injection. Radiotracers can be synthesized using cyclotron. Basically, the cyclotron smashes the radioactive isotope to the carrier molecule. As radiotracers have limited shelf life, they need to be made fresh in laboratories before every uses. The radioactive FDG poses little danger to the patient due to their short half-life of around 110 minutes. FDG that gets absorbed into the body undergoes radioactive decay and produces positron, which is the antiparticle of electrons. A positron interacts with an electron through annihilation, releasing a pair of gamma rays that travel at opposite directions. Since gamma rays have high penetrating power, it will not get blocked by organs, tissues, and bones, but will only be attenuated. The PET scanner is like a big ring of Geiger counters. The ring-shaped arrays of detectors in the PET scanner detects pairs of gamma-rays photons to determine their intensity and attenuation. With the help of a computer algorithm and repeated measurements up to 1,000,000 times, we can construct a 3D image of the distribution of FDG in the body. From describing the application of Radiotracer in medical imaging, we also highlighted how impactful the discovery and the studies of radiation is. I hope you enjoyed this video. Thank you.